from assessment to treatment goals. We conduct biopsychosocial assessments to gather information from clients and their families about why they're seeking out therapy. We also seek to identify the biological, psychological, emotional, and environmental factors that are influencing the problem and what has led to their decision to seek our assistance at this time. In this manner, biopsychosocial assessments contain data about the client, their families, their environment, and their description of the problem. We then develop treatment plans that strive to bring about changes in client systems' behaviors that ideally will last beyond the end of treatment. Treatment plans are meant to be time limited and include action steps that lead to client system changes overall. Treatment plans are essentially the action plan for therapy. Case conceptualizations lie between assessment and treatment planning. Case conceptualizations link the data to the action plan and represent clinicians' understanding of the data and what might need to change in clients' lives or social environment to bring about lasting change. During biopsychosocial assessments, clinicians consider systems perspective, stages of behavior change, and the cognition, emotion, behavior triad to develop both case conceptualizations and treatment plans. These elements interact and exist within a context and change over time. Therefore, there is a need for continual assessment. In the next set of slides, I'll briefly explain each of these elements. The systems perspective suggests that multiple elements in the micro, meso, and macro levels interact to produce multiple outcomes and situations. The micro level can be the individual or family, which is surrounded by a neighborhood, and a larger society that has values, beliefs, and norms that influence both the neighborhood, the community, and the individual. These influences also can fuel risk and protective factors for particular outcomes, produce beliefs and attitudes, as well as individual, family, or community dynamics. The stages of behavior change model explains how people go about changing their behavior. Although the graphic suggests a linear process, people in fact move back and forth through the model. Thus, a person might start off at pre-contemplation, move to contemplation, and then move back to pre-contemplation. The movement through the stages of behavior change can be influenced by elements in the system's perspective, including the individual themselves, family, peers, neighborhood, and larger society. No one element from the systems surrounding the identified client can override the process because, as the system perspective suggests, things interact. The last element is based on theories of human development, in that scholars argue that cognitions, or thinking, precede the development of emotions and behaviors. Other scholars argue that emotions precede cognitions and behaviors. While another group of scholars tend to start with behaviors, researchers now understand that all three are important and interrelated, and a person's starting point changes over time. Each of these components, however, tacks onto a different treatment modality. Thus, assessing where the client is at in this triad can help treatment identify treatment modalities. To identify a presenting problem for a family or an individual, we look at the multi-level influences on the problem. Each problem has multi-level influences. We use the systems perspective to guide this investigation. We then consider where the individual or family member is in the stages of behavior change. This determination will help us identify where to begin, in that we may have to start an action step that moves a person from pre-contemplation to contemplation, even if they're not thinking about behavior change. Finally, we have to assess where people are in their cognition, emotion, or behavior triad. Because if a person is rationalizing a problem, which is just thinking about it and trying to make sense of it, then an action step might be to get a person in touch with their feelings that is related to the problem through the use of emotion-focused therapies. By going through this process, we're more easily able to identify suitable behavioral goals and treatment plans that align with where the client is at the point in the assessment.